exposing the surge in America's West, where the landscape is as vast as the challenges now facing its communities. In recent weeks, a new chapter in the ongoing COVID-19 story has begun to unfold, and it's one that's catching the attention of health officials, scientists, and everyday people alike. The Stratus variant, a name that's quickly becoming familiar, is at the center of this latest wave. But what exactly is happening, and why should you care? Let's break it down. The Stratus variant is making headlines across the country, dominating news cycles and sparking concern in both local communities and national health agencies. As the story develops, it's important to separate fact from fear and to understand what this means for you, your family, and your community. Here's what you need to know right now, as the situation continues to evolve. Let's get straight to the facts. The Stratus variant, also known by its scientific designation XFG, is a new strain of the coronavirus that has shown a unique pattern of spread and symptoms. Health experts are closely monitoring its trajectory, and early data suggests it's more transmissible than previous variants, though not necessarily more severe. Still, the speed at which it's moving through certain regions is raising alarms. What sets Stratus apart from earlier variants is its ability to evade some immune responses, making it easier for people to catch, even if they've had COVID before or are vaccinated. This doesn't mean vaccines are useless, but it does mean breakthrough cases are more common, and the virus is finding new ways to spread. Researchers are working around the clock to understand the genetic changes that make Stratus unique, and to determine how best to respond. As of August 2025, the US is seeing a notable COVID-19 surge, driven by the new Stratus variant, also called XFG, and its cousin, the Nimbus variant. Hospitals in several states are reporting a steady increase in admissions, and testing sites are once again seeing long lines. The numbers are climbing, and public health officials are urging people to take precautions seriously. Stratus was first spotted in Southeast Asia earlier this year, where it quickly became the dominant strain in several countries. Scientists believe international travel played a key role in its spread, as travelers unknowingly carried the virus across borders. The variant's rapid rise in Asia served as an early warning for the rest of the world, prompting increased surveillance and testing in the United States and beyond. By the time Stratus was detected in the US, it had already established a foothold in multiple states. Airports and border crossings became critical points of monitoring, with health officials ramping up efforts to identify and isolate cases. Despite these measures, the variant's high transmissibility allowed it to spread quickly, especially in areas with lower vaccination rates or relaxed public health measures. It's now spreading rapidly, already accounting for a significant portion of new US cases. In some cities, positivity rates have doubled in just a few weeks. The impact is being felt in schools, workplaces, and homes as more people test positive and are forced to isolate. Local governments are once again considering mask mandates and other interventions to slow the spread. Wastewater data confirms a moderate jump in viral activity, and the CDC says cases are clearly rising in 31 states. Wastewater surveillance has become a crucial tool in tracking the virus, often detecting increases in community spread before clinical cases are reported. This early warning system is helping health officials allocate resources and prepare hospitals for potential surges. Which states are being hit hardest? The data paints a clear picture. While the surge is nationwide, certain regions are experiencing much higher rates of infection. Public health experts are closely monitoring these hotspots, looking for patterns that might explain why some areas are more affected than others. Factors like population density, vaccination rates, and local policies all play a role. Right now, the numbers are highest in the West and the Southeast. These regions have seen a sharp uptick in cases, with some states reporting their highest positivity rates since the previous winter surge. In cities like Los Angeles, Houston, and Atlanta, hospitals are preparing for a potential influx of patients, and public health campaigns are ramping up to encourage vaccination and mask use. New Mexico, Texas, Oklahoma, Arkansas, Louisiana, Nevada, Arizona, California, Alaska, Washington, Oregon, and Idaho, each with test positivity rates above 11%. These numbers are a stark reminder that the pandemic is not over, and that vigilance is still needed. In some rural areas, access to testing and healthcare remains a challenge, making it even more important for residents to take precautions. Symptoms to watch for: fever, chills, cough, sore throat, congestion, body aches, and for Stratus, a hoarse voice is common. Some patients also report fatigue, headaches, and loss of taste or smell. though these symptoms are less frequent than in earlier waves. If you or someone you know develops these symptoms, it's important to get tested and stay home to prevent further spread. Early detection can make a big difference, especially for those at higher risk of severe illness. People with underlying health conditions, the elderly, and those with weakened immune systems are especially vulnerable to complications from the Stratus variant. If you fall into one of these categories or care for someone who does, take extra precautions. Make sure you have a plan in place in case you need to isolate or seek medical care, and keep in touch with your healthcare provider about any new symptoms. If you develop trouble breathing, chest pain, confusion, or blue lips or skin, seek medical help immediately. These are signs of severe illness and require urgent attention. Don't wait to see if symptoms improve on their own. Early intervention can save lives. Emergency rooms are prepared to handle COVID-19 cases, and prompt treatment can make a critical difference in outcomes. The good news, current vaccines still work, and a new formula is on the way for fall. While breakthrough infections are possible, vaccinated individuals are far less likely to experience severe illness, hospitalization, or death. Booster shots are being recommended for those at higher risk, and pharmaceutical companies are working to update vaccines to better target the Stratus and Nimbus variants. Stay tuned for announcements about when the new shots will be available in your area. Experts recommend masking in crowded spaces, washing hands often, staying home if you're sick, and keeping your vaccines up to date. These simple steps can make a big difference in slowing the spread of the virus. If you're planning to travel, check local guidelines and be prepared to adjust your plans if conditions change. Remember, protecting yourself also helps protect those around you, especially the most vulnerable members of your community. Community efforts are also making a difference. Local organizations are stepping up to provide masks, tests, and information to those who need it most. If you're able, consider volunteering or supporting these initiatives. Every action counts, and together we can help slow the spread and protect our neighbors. Stay safe, stay informed, subscribe for more need-to-know health updates. As the situation with the Stratus variant continues to develop, we'll keep you updated with the latest facts, expert advice, and practical tips to help you navigate these challenging times. Remember, knowledge is power, and together we can face whatever comes next.